Hi, my name is Dr. Ann Carr. I am a neurosurgeon. I started getting interested in medicine actually when I was pretty young. I always liked to have my little hospital set up with the stuffed animals, and I would always bring home little animals home to mom, which was always a big, everyone really loved that. And then I kind of got into some other things when I went into high school and college, but then I circled back to medicine because I knew it was something that I really did enjoy. When I went into med school, I went to Texas Tech University, and it's a very primary care school, and that's what they were based on, is making primary care physicians. And I went into med school thinking I wanted to be a pediatrician. So that was the plan to start with. So I did 2 rotations, 2 weeks of neurosurgery, 2 weeks of orthopedics. So after my month of general surgery going, this is kind of great, I like this. And then I did neurosurgery for 2 weeks and it just hit me. Sometimes you can really make somebody better from the very beginning, and you can take someone who's getting weak on one side and you can find the problem and you can hopefully take care of that problem and then get them set up and then get them treated. It's even in the OR, even now, I go and you see the brain and you know that, in my opinion, that's where the soul is, and you start looking at it and it really just, it still takes your breath away. It's still I just still really, really enjoy it. I do my best to sit down and answer questions and spend the time that they need to get all their questions answered. And I find that's a lot easier because I find an educated patient is a happy patient. Well, I do a lot. I like to read. That's pretty common. I like to swim. I need to find a house with a pool here. I also sign up for the Disney runs. Now mind you, I'm in the back because I'm slow, but it's one of the things that helps kind of keep me in shape, and it gives me an excuse to go to Disney. It's my only complaint I think about Pensacola is it's farther away than Disney than I used to be. But it's something that I enjoy as I'm going out, and it gives me a reason to train because, I don't know, there are some people that really love to get out there and run. It makes them happy. Not my thing. But it sets my competitive nature. If I set a goal, I've signed up for it. Therefore, I will, get on the treadmill and get the exercise that I know is good for me. And we tell our patients, you really need to get out and exercise. Got to practice what you preach. Got to get out and exercise.